Good morning, everyone. Welcome to the second presentation as part of our Hidalgo County Wellness Program 2021 Virtual Wellness Fair. My name is Diana Hualpa with the Hidalgo County Wellness Program, and I'm really glad that you joined us today. Before we get started, we want to make sure that the technology is working. So if you can please click on the raise hand icon that is located at the bottom of our Zoom webinar software, I would really appreciate it. Again, if you can see your slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is part of our Zoom webinar software. Thank you so much. It looks like we're good to go technology-wise, and I'm really excited to see a lot of people joining to these presentations. I do have a few reminders before we get started. Reminder number one is that we do have 10 additional presentations as part of our 2021 Virtual Wellness Forum. Therefore, if you haven't set up a reminder for this or any of our upcoming webinars, I do invite you to do so through our Virtual Wellness Fair website or our Hidalgo County Wellness Program website as well. Our second reminder is that you are on listening only mode. However, you are able to submit questions via our Q&A forum on our Zoom webinar software throughout the presentation, and we will have a Q&A session at the end of the presentation. At this point, I do want to introduce our physician, that is Dr. Maria Colón-Gonzalez. Dr. Maria Colón-Gonzalez graduated from the University of Puerto Rico Science Medical Campus, School of Medicine. And after graduating from the university, she completed her residency at Penn State and her fellowship at Brown University. Maria Colón-Gonzalez decided to join the University of Texas, Rio Grande Valley as an assistant professor in the Department of Family and Community Medicine. Her experience in the Rio Grande Valley includes working in urgent care, occupational health, telemedicine, and primary care. She is passionate about empowering patients as agents of their own health via holistic care. Dr. Colón currently serves as the lead physician for Vera Whole Health, Edinburg Care Center. Dr. Colón, thank you so much for being here with us.
Thank you. Thank you for the invitation, Diana. Let me see if I can turn my camera on.
Perfect. No, and thank you so much for taking the time this morning to be here with us and share this important information with our employees regarding diabetes.
Thank you. Thank you. So do you have the presentation so that
Yeah, you can actually share the presentation and we are able to see it. So it looks like we are good.
Okay. Give me a moment.
Absolutely. How's the clinic going today? Good?
Good, good, good.
Okay.
And let me see. Share screen. Can you guys see the presentation now?
It's starting, and yes, we can go ahead. We can see the presentation.
Okay, sounds great. So welcome all. My name is Dr. Colón. I am, as Diana said, the lead provider here at Vera Whole Health in your clinic in Edinburg. And today we're going to be talking about diabetes. We're going to be talking specifically about type 1 and type 2 diabetes. There is also, what gestational diabetes, which is through pregnancy. And then there's also type 1.5 diabetes. Are you guys having issues seeing the presentation, or can you still see it well, Diana?
The presentation went down for a little bit, but it's now back already. So hopefully everything should be good. The sound, we were having a few problem hearing, but we can go ahead and try it and test it a little bit more and see if it's better.
Default speaker has been changed. They put it in automatic.
And we are having some technical difficulties, so if you can just give us a few minutes, we'll make sure to solve those, and we'll be back presenting regarding diabetes.
No, no, at this point. Because my mic is moving.
Yes, we can hear you, and it seems that the sound is a little bit better, so we should be fine. I know that we did stop the screen, so if you want to go ahead and share that screen again, and then we should be good to go.
Okay. Okay, so we were talking about type 1 and type 2 diabetes. And basically, you know, the biggest difference between type 1 and type 2 diabetes is that in type 1, our own body is producing some proteins that will slowly attack the pancreas, right? And basically your body's destroying the pancreas. And the pancreas is the organ, right, in our body that produces the insulin. In type 2 diabetes, our pancreas is still producing insulin. It's just that it's not enough for the amount of sugar that we might have in our bodies. So basically, you know, blood sugar comes from everything that we eat. Not only carbohydrates, right? What we know typically as like grains, but also think, you know, your fruits, your vegetables, your legumes, things like beans, lentils, everything, you know, will produce a little bit of really glucose, right? That's the type of sugar that our body uses as energy. And then also the liver. So the liver is one of the organs that we have inside our belly. And the liver will also be slowly, you know, taking some sugar into the bloodstream, right? So those are our two sources of glucose or sugar that we need, you know, for energy constantly because we're breathing 24/7, 365 days a year. And basically, so what happens, you know, when you have diabetes? So when you have diabetes, there's not enough insulin to take that sugar into your organs, right? So I always like to think of diabetes as the little car, right? And the sugar is the passenger. So we need that car to transport the sugar all across the body. And when we do not have this car, what happens is that the sugar just stays, you know, inside, you know, like in the blood, right? And think about like a long line of people, kind of like when COVID started, that you had this long line of people around the grocery stores. So that's basically what happens with the sugar. It forms a long line and it's trying to get into the cells, into the organs, but it just can't because it's missing the car, and that car is the insulin. So how can, you know, we help the body use a little bit better this car, the insulin? And this is what type 2 diabetes, people that have type 2 diabetes can do. And type 1 is a little bit different. But basically, you know, if we lose weight and we change the way that we eat, we will help the body use better this little car. And how can you know if you are having problems using the car, using the insulin in our body? So people that get extra weight, extra abdominal fat, right? That's why here when you come to the office, we check your waist circumference. Also, when your triglycerides are high, they're going to compete, right, for that, car. So both the triglycerides and the sugar need the car, right, to be able to get to where they need to go in our bodies. Another sign is when your good cholesterol is low. And what we know as the good cholesterol is the HDL. So if your doctor tells you your good cholesterol is low, that can be a sign that your body's not using the insulin in an appropriate way, and that car is kind of like running out of gasoline and cannot take the sugar where it needs to go. High blood pressure, especially if you have, your sugar levels checked after you have not eaten for at least 8 hours. And what we call acanthosis, and acanthosis is basically around your neck, right? You would see this darker line, right? So the pigment or the color of the skin will get darker. And that's what we call acanthosis. When you start to have problems using the insulin in your body, you might get more hungry and you start craving sweets, and not only sweets like candy, but also those processed carbohydrates like bread and muffins and pan dulce. You will feel very sleepy after you have a big, large meal. So think about if you're getting sleepy after lunch, think about what you ate at lunchtime. But for some people, insulin resistance, when you start to have problems with the insulin, you might not have any symptoms. And sometimes that's why by the time that you know that you have diabetes, right, it's sometimes a little bit advanced. So what can we do to reduce, our risk of having, diabetes or complications with diabetes? Well, you want to make sure your doctor is checking your blood pressure at every visit, and you want them to tell you what your blood pressure numbers are. All diabetics should be paying attention to their feet, and you want to look, at the plantar aspect, and you want to check between like your toes also. And what we're looking for is any type of injury, right, that you see, this is not healing well. That's very important for a diabetic. Depending on where your A1C is, we might want to check it every 3 months to every 6 months. Diabetics also tend to have problems with their dental hygiene, right? So it's very common to see people with diabetes developing gingivitis or advanced, diseases in their mouth. And then we always want to make sure, that you're getting your yearly cholesterol check. We also like to do the diabetic eye exam. If you do it and it's normal, we don't repeat it until, 2 years. If it's abnormal, we have to repeat it more often. And then we also want to make sure that your kidney is working well, because sometimes diabetes starts to affect the kidneys. And what can you do, to make sure that your blood sugar level is where it should be? So one of the first things that you can do is check your sugar in the morning when you wake up. I always tell my patients, you go to the bathroom, you wake up, you go to the bathroom, you void, and then you come back and sit in your bed and you check your sugar right there without ingesting anything and putting anything in your mouth. For a diabetic, we like that sugar to be below 110. Now, if you're not using insulin, you might not need to check your sugar throughout the day, but people that are using insulin with meals do need to check their sugars with meals. And, what can you do? Well, every time that you eat, you want to make sure that you're balancing the type of foods. We want to make sure that you're eating your fresh vegetables, your fruits, healthy proteins. And if you're going to eat grains, we want to eat wholesome grains. And we want to try to avoid those that we call processed carbohydrates or simple carbohydrates. I always like to tell my patients, the more you move, the better. And it's not necessarily that you start running marathons, but we do want to make sure that we're using our muscles and that we're moving all of the joints that we have in our bodies. Of course, you want to take your medications as they're being prescribed, and then you want to check your sugar as instructed by your physician or your primary care provider. And remember that part of diabetes care is that whole person care, right? So yes, for diabetes, we check the numbers like the A1C and the cholesterol, but we also want to make sure, right, that your mental well-being is healthy. We do know that people that have diabetes, they get some stress because of the disease, because it's hard sometimes to be checking your sugar. It might be hard to go to family events and perhaps not eat of the same food. And of course, we want to make sure also that we're prescribing medications, for example, that you can afford. And so that is the type of comprehensive plan that we do for our patients that have diabetes here at the clinic. And also remember that we have the health coach. And the health coach at Vera Whole Health will help you identify what are the specific goals that as a person living with diabetes you want to work with. We want to help you identify what are the barriers to reach those goals. And we want to create a plan and how we can overcome those obstacles and how can we help you overcome those obstacles so that you have a plan that is tailored to your specific needs. And of course, the health coach will check the progress in that plan. So remember to visit our care center before the end of the year, so before December 31st. So that you can earn your $200 incentive. So all eligible employees who book their preventive wellness visit before December 31st of this year will receive a 200 credit toward their 2022 deductible. And this is where we are located. So our office hours are Monday, Wednesdays, and Friday, 7 in the morning to 6 p.m. Tuesdays and Thursdays, 7 in the morning to 7 p.m. And then I do not know if we want to take questions now, Diana.
Absolutely. Thank you so much, Dr. Colón. Yes, and let me just go ahead and share my screen at this point. I'll go ahead and start the Q&A session. So feel free to send any questions that you may have to our Q&A forum, and we're going to go ahead and start taking them. But the first question that we have is, can a person that is not overweight have diabetes?
Yes, so that's a simple answer. Yes. There are, as I said, different types of diabetes, right? So diabetes type 1, the one that is autoimmune, where your body produces the proteins that attack the pancreas, is common in people that have, what is considered a healthy or a normal weight. We also know that there is what we call the type 1.5, right, diabetes, and that is fairly new. But we do know that these are patients that have already started to develop diabetes. Their body has already started to produce these proteins that are attacking the pancreas, and they present like a type 2 diabetic, and they can have a normal weight. So not necessarily being overweight means that you will or you will not have diabetes. That is why it's important that when you come to your doctor, like when you come here to Vera, we always screen you for diabetes independently of your weight.
Absolutely. Thank you so much, Dr. Colón. And the next question that we have is, my husband is borderline diabetic. What important steps do you recommend for him to reverse this?
Yes, absolutely. So I always say diabetes is completely reversible. So one of the important things will be to be physically active. And again, I like to tell the patients sometimes, think what provoked fun when you were growing up. What did you like to do to play? And can we think of physical activity more like playing instead of this exercise thing that is another thing to do in my list so that it can reduce the burden? Sleep and stress is really important. When we do not sleep at least 7 hours a day, this hormone that is called cortisol goes up in our body. And when that happens, our sugar level stays elevated. And then, of course, the food, right? And we need to start to think about not only the added sugar, not only honey, not only the agave, but then think about anything that you're buying in a box, in a can, in a bag, and look at the ingredient list. See if it has fructose, if it has corn syrup. You know, sugar comes with so many names that we really have to learn where is our sugar coming, you know, every time that we eat, and we want to reduce the amount of sugar that we want to eat. And basically, if we start addressing those 3 big pillars, our A1Cs will start going down.
Thank you so much for that answer, Dr. Colón. Our next question is, if your parents have diabetes, is it hereditary?
Yeah, so it depends, right? We do know that type 1 diabetes can be hereditary, right? People that have type 1 diabetes also, because it comes with the genes, might have problems with other hormone-related diseases like thyroid, right? When it comes to type 2 diabetes, what we do know is that your genes do have an effect, but when it comes between nature versus nurture, we do know that nurture, so how we take care of ourselves, has a greater impact than our genes.
Okay, perfect. Thank you so much. And that's why it's so important for us to continue to have that holistic approach so we can continue to prevent these conditions with our lifestyle, right, Doctor?
Yes, absolutely.
Perfect. The next question that we have is, do you recommend sugar alternatives or cutting it out completely?
Yes, so that's a really good question. So, you know, I'm guessing that when the person is talking about sugar alternatives, they might be talking about things like Splenda or Sweet and Low. So if we're talking about those type of alternatives, we do know that those type of sugar changes in our body what is known as the gut microbiome. And the gut microbiome is the bacteria that we have in our bowels that make us do that digestion and that produces, that help us produce like the poop, right? And what we know, and the gut microbiome and these studies are fairly new because science has advanced, but what we do know is that when we eat or when we take antibiotics that adversely affect this good bacteria that we need to have in our body, that will affect not only our sugar level, but it also increases our risk of developing obesity, and it also increases our risk of having a heart attack. So my patients, I like to tell them, if you want to eat something sweet, really think about fruits. So natural fruits in their way, and maybe in very small quantities, perhaps something like agave, right? And it's not something that we want to do with all of our meals, right? But for example, like 1/4 cup of a teaspoon into maybe your coffee if you really need to have it sweet. And slowly, as you start to eliminate sources of sweetness, right, our tongue starts changing and our brain starts changing, and it's even easier to reduce, that sweetness in our food.
Okay, thank you so much. And I guess as a follow-up question to that, we do have one that says, can natural sugars from fruits or honey contribute to diabetes?
Yes. So, you would need to eat them in very big quantities, right? So because of how natural fruits are designed by nature, the amount that you would need to eat to get the same amount of sugar that, for example, if you eat a donut or pan dulce, is so much that the majority of the people cannot fit that much quantity into the bellies, right? So for example, if what you're going to eat is maybe half a banana or 1 banana with your meal, that's fine. But you probably don't want to do 10 ripe bananas, right? So, with some fruits, the ones that are a little bit higher in the concentration of sugar, so think bananas, watermelon, your grapes, those we want to eat in a little bit a smaller quantity, but knowing that that is much healthier than if you eat, a piece of pumpkin pie, which is just coming around the corner.
I know we are in that season. So yes, definitely. And just, I guess, to add another questions we do have from another employee is, can you become diabetic if you eat too much sweet?
Absolutely, right? So, we know there are certain, so when we talk about food is divided into like little small groups, right? And we know that, there are within these small groups, even smaller little groups. And it's these smaller little groups that cause the problem, right? So for example, if you're saying that your source of sweet or sugar is a cup of blueberries every day, in the morning with breakfast, that might not necessarily lead to diabetes. Then even if you're eating, 2 breakfast tacos from Stripes. Why? Because that small little type of molecules, right, is what's making the difference. If you eat too much sweet, if you eat too much added sugar, right, the sugar that comes that we can pour in, like it's in the sodas, in the fruit juices, and of course the candies and the sweets that we like to eat, or in those processed carbohydrates like your tortilla, your white rice or your white pasta or your breads. Those are the ones that are going to raise not only the sugar, but that have these other little small groups of foods that will change, things in your body that will lead to diabetes.
Perfect. Thank you so much, Dr. Colón, for that information. The next question that we have is, does the Vera Clinic provide food exams or refer to a food specialist for diabetic patients?
Yes. So we do here, the like the first type of food exam, right, which is the visual inspection. We have the capacity also, we have a little instrument that is called a monofilament, which we're going to then test to see, if you feel. And then depending on other risk factors, we have 2 additional tests that we can do. One that checks to see your blood flow, and then the other one checks to see if there is any further damage to, your nerves and your sensation, right? So let's say that we do all of that here and we do find, right, that there is something significant going on, we might need to refer you. And what I mean by that is, if you're a diabetic patient that also has like ulcers or calluses, then you will need to be referred, whether it be to wound care or to a podiatrist, to take care of those. Because diabetic feet, people that have diabetes, we really want to make sure that your feet stay really, 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 really healthy, because we do know that it's one of the things that can lead to things like amputations, and we really want to prevent that.
Thank you so much. And I do want to mention, just adding to what you mentioned, Dr. Colón, Vera Whole Health does have a booth on our exhibit hall, so feel free to go to the exhibit hall and chat a little bit more with Dr. Colón and, of course, Joanne, who is our practice manager for the clinic. But we do have one more question, and I guess it's going back to our breakfast. So is oatmeal a good choice for diabetes? I have been told yes and no.
Yes, so that's a really good question. I think that it goes beyond just oatmeal, right? And I want to make this simple. So there's different type of oatmeals, right? So when you look into the store, there's what we call the quick oats, like the ones that you can put in the microwave and cook quickly. They're really good at breakfast time because we're on the run. what happens is that they have taken the oats, right? And in order for it to be put into the microwave and be done quickly, they have taken a lot of the protein and a lot of the fiber. And from this big, it becomes this little tiny little bit of oat. That type of oatmeal your body will metabolize it or will convert it into sugar, right? And then you also have to think about, what am I putting to my oatmeal? So if you're, for example, doing, oatmeal that is not the quick oats, and what you're using is just fresh fruits, right? So blueberries or strawberries, and then you're not, adding any type of honey, agave, or sugar, then that's, much better. And if you need an extra source of protein and fiber, one of the best tricks is actually to use some lentils. So you can combine some oatmeals with some lentils. The lentils won't change the flavor of it. You can still put your spices and your vanilla and your cinnamon, but it will add then your protein and then your fiber. It will sustain you longer, so you won't get as hungry, and it won't peak your sugar as much. So really the trick when it comes to grains is what type of grain I'm eating.
That's a great tip regarding the oatmeal and the lentils. I haven't heard it, so it's amazing, I think, definitely. And we do have time for 2 more questions. So the next question that we have is, how can I know how many carbs can you eat on one day?
Yes, so that it will depend. That's a more personalized question. That will depend on a couple of things, right? So do you have any medical conditions? It will depend also on your weight, your sex, and then what are your health goals? So there's really not, a one type of answer that I can, give to that person. My recommendation is, if you want something that is very personalized and tailored, then call the care center, schedule an appointment, and then we can help you with something that is very specific to your unique needs.
Absolutely. And the last question that we have is, why does protein show up in the urine?
Yes. So there are a couple of things that can cause what we call micro injuries, so very tiny little microscopic injuries in our kidneys. The 2 most common are high blood pressure and high sugar levels in our blood. The kidneys naturally filtrate the proteins, and the proteins stay in our blood. That is the healthy thing. When that filtration system has been broken, and now the holes from being this small is this big, the protein will come out. And when the protein comes out in the urine, we know that there is already damage to the kidney that is still reversible if we take some steps. But we do know that then this person needs more specific care and attention, and we need to monitor that, what we call the kidney function, closer, because we do want to prevent, again, hemodialysis. It's all about prevention.
Absolutely. Well, thank you so much, Dr. Colón. Thank you for being here with us and taking the time to be here and present these to our county employees. We really appreciate it. And thank you everybody for joining us. I do want to remind you that we do have a couple more presentations, and that Dr. Colón and Joanna are going to be in the exhibit hall in their booth. So feel free to chat with them later today. And thank you so much for your time. Stay safe and stay healthy. Thank you so much.
Thank you, Diana. Goodbye.
Bye. Thank you, Dr. Colón.
Bye-bye.